Having a C-section, whether planned or unplanned, can make it harder to breastfeed. However, the good news is that lots of mothers who have a C-section go on to breastfeed successfully, and there are lots of things that we can do to make breastfeeding easier. If a C-section is planned, it can mean you don't go through a normal labour, and this can lead to a delay in your body producing the hormones that you need to kickstart breastfeeding. Conversely, you may go through a long and difficult labour leading to an unplanned C-section, and this in itself can lead to exhaustion and stress, which can also delay the production of these hormones. After your baby is born, the best way to help your body to make these hormones is to have lots of skin to skin and to bring the baby to the breast as often as possible. Sometimes having a C-section can lead to a delay in skin to skin and that first feed. This can be unavoidable because of medical care needed by you or by your baby, and in that situation, skin to skin with your partner can also be beneficial for baby. It can be important to let your healthcare professionals know that you would like to have early skin to skin and an early first feed, and that can help them to support you in achieving this as much as possible. A successful early first feed can be challenging for various reasons. This can be because of separation between mother and baby, as we've discussed, or it can be because baby is drowsy from medications given during the birth, or perhaps because baby has mucus in the lungs from being delivered via C-section rather than vaginally. All of these things can make it a little more challenging to have a successful first feed. In these situations, you can consider hand expressing to produce some colostrum, which you can give to baby as your first feed, and this can also help to stimulate more milk production from mum. You yourself may find it hard to breastfeed after a C-section because of pain or because of loss of mobility. Good pain relief can help with this, and considering different breastfeeding positions like side-lying positions or laid-back positions can also help to make breastfeeding more successful and more comfortable. So while it can be harder to establish breastfeeding after a C-section, it's useful to remember that lots of mothers can still breastfeed successfully with the right help and support. And don't hesitate to ask for help to have your baby given to you so that you can have uninterrupted skin-to-skin time and also plenty of opportunities to bring the baby to the breast and feed as often as possible.